Hello, my name's Sonya English. I'm an intensive care nurse. Currently I'm a critical care outreach nurse, which means that I rescue people in hospitals. So I get paged or I get called by someone in the hospital to come and see a patient that's deteriorating. I've worked in intensive care for around about 27 years or maybe a little bit more, and over that time I think one of my esteemed colleagues once said to me that we get a front row seat to human tragedy, and I think for me that's a privilege. It's a privilege to work with those people, but I've seen so many changes over that time, and I think that's one of the things that's brought me to Precure, is that I really have a concern around chronic illness. I think when I first started, we used to see people come in, they might have had their heart surgery or their general intensive care admission, and return to a good quality of life. But over the years, I've seen chronic illness creep down into 30-year-olds, 40-year-olds, and even recently 20-year-olds who've got things like heart disease and end-stage heart disease, renal disease, kidney disease, they have diabetes, dementia at young ages, and these things are so frustrating for myself and my colleagues because we can actually do something about them, we can prevent them. It costs the healthcare system a lot of money, but it also, I think what resonates with me mostly is that the looks on families' faces and patients' faces when I come to see them. So as I said, I'm called to see these people. They're deteriorating before my eyes. They maybe can't breathe. They maybe have no fluid left in their system, so they actually can't perfuse their brain and their organs. They have maybe end-stage kidney disease, so they're very sick, they're sweaty, they may be semi-conscious, and I've been called in with a team of people to rescue them. And I I'll start resuscitating, I'll call specialists and try and bring them back. But whether I can do that or not is often negligible when they're very chronically ill. And some of the patients that I see, I've seen often monthly for years. I know them by first name. So the frustration of that in healthcare and not being able to do anything, seeing them get pill after pill, and sheets of different pages of pills that they get every time they come in and get no better. In fact, they probably can walk less than they did a year ago. So for me, Precure is about preventing this, having a prescription to prevent this admission to the hospital and have a better quality of life.